So proton beam therapy is essentially a type of radiation treatment, and most radiation treatment in this country is given by high-energy X-rays. The beauty of proton beam therapy is that while X-rays have an entry dose and exit dose, so they go into the body, treat the tumour, but then they have to exit through the other side. Proton beam therapy has an entry dose, treats the tumour, but due to its physical properties has no exit dose. So you can immediately see that less normal tissue will be irradiated. It delivers essentially the same dose of radiation to the tumour, but less to the surrounding normal tissue.
How long has this therapy been around? How long have people been really grasping its potential?
So this therapy has been known for a very long time. So there have been centres in the United States and in Switzerland and in France treating since the 60s and 70s. However, these have been in small numbers of patients in essentially physics laboratories as the technology has become more mature. In terms of real clinical use, that's really taken off in the last 10 years or so in a bigger way.
So in the last 10 years, does that mean that Britain is behind the curve on this? Even though I've said that you're leading the way in terms of your NHS trust, but if you look at the provision in Britain...
So I think you have to think about the provision in two ways. So the provision, do we have a high-energy proton centre here in the UK? No, we don't at the moment, but this government has committed to provide two centres, one at University College Hospital in London and one at the Christie Hospital in Manchester, to provide this therapy. In terms of provision, though, we do have a overseas programme that have been sending patients abroad on a highly selected indications list since 2008. And if you look at it from that point of view, when compared to lots of European countries who have proton beam centres within their countries, and even in North America, we probably have one of the most comprehensive access to proton beam therapy for those patients with the highest needs.